So you might have heard of All-on-4 dental implants. What about All-on-6 or All-on-X? What it really comes down to is how many dental implants you get. But what distinguishes whether how many implants you get in your mouth, whether 4, 5, 6, 7, or 8? In this consultation, I explained to a patient what factors would affect whether how many implants she would need in the future. So stay tuned to this video.
Hi, Christina. Hi, how are you doing? I'm Dr. Choi.
Nice
For this video.
Hi, nice to meet you as well.
So
Hi,
where do you live?
Midlothian.
Oh, okay, cool. So
Yeah.
you're not that
About
close.
45
but
minutes.
45
Yeah,
minutes?
not too
Okay,
far.
not too bad.
That's what we wanted to do, is come to see you.
Okay, awesome,
Cool.
awesome. So what questions can I answer for you? I know you already had a discussion with Rodney, but
Yeah, we've seen a lot of different, videos and, seen a lot of different dentists and researched a lot about these. And I've actually seen a dentist prior to you
okay.
that recommended this procedure. His oral surgeon that does his implants in his office came in, and it just wasn't a really good match. It wasn't a good experience. He showed me some of the, prosthesis that he was going to do, and some of them had like this metal piece, and it was just, so I watched your video and I'm like, oh, okay, well, that makes sense. That's probably not, what we need to go, lean towards. So this is what, I want to do.
Okay, cool.
This.
So it sounds like you did some research then.
Oh, yeah.
Okay,
Yeah, for
cool,
sure.
cool.
For sure.
Alrighty. So I would agree with that assessment that All-on-4 would be a good match. How long have you been missing those teeth back there?
I would say 4 to 5 years.
Okay.
Yeah.
Cool.
It's been a while.
So what's your driving interest in why you're doing All-on-4 now? Have you had any discomfort?
Yes, lots of discomfort. And just, with obviously eating, it's very uncomfortable. I have a lot of sensitivity. I have pain in these back teeth up here.
Okay.
I know that there's a lot of just issues with the crowns that I have already.
Okay.
I guess they weren't done correctly, and I would have to go in and get them redone. I have a lot of root canals, and so it's just a lot of just discomfort that I'm to this point that I'm ready to just do this.
Okay.
I'm just done.
Okay.
I'm done with all the dental, treatments, and having to go down that road is just not what I want to do.
Okay.
So
Totally get it.
Yeah.
That's what a lot of our patients will say.
yeah.
But I totally agree with the combination of, I do see you have some very large cavities in some areas that would be causing discomfort.
Right.
I see obviously these crowns and all these root canals, and then if we were to you actually have large sinuses too. If we were to try to do all the necessary bone grafting, individual implants, crowns, it would just be like an endless chase.
Oh, I know. Yeah.
Can I see something? Can I have you smile really wide for me? Okay. So you have about a pretty average lip line. So what I'm kind of evaluating is like how high your lip goes to see like how much of your gums I see also.
Okay.
Okay, cool. So just to kind of share with what we see on Dr. Koo and I already studied your 3D scan. So the great news is that you do kind of have large sinuses, but you also have great bone.
Okay.
Okay, so that's really good.
Okay.
Dense bone. This is what we like.
Okay.
So you got good volume and you got good density of bone.
Okay.
Also, depending on how many implants that you decide to go with, because you're 42. Okay. Oh, you're like 37. Okay, so you're, I'm 46.
Yeah.
I consider I feel like we're young, right?
Yeah.
So we want to make sure that we have a long lasting, I tell people All-on-4 is fantastic.
Yeah.
And if you saw some of the videos the actual, if I had time to make more videos and you actually saw things that happens with dental implants when not done properly.
Yes.
Man, All-on-4 is a great solution, but if it's not done properly, you can have a very not ideal result.
Oh, we've seen them.
Right.
Yeah, we've seen the bad, what can happen and all that.
Right.
Researched a lot.
And so the reason why I tell you that is that, so you'll have the option of 4 or 6 implants.
Mm-hmm.
I would recommend 6 implants because what you're going to be able to do is distribute that force better.
Okay.
Okay. And I also tell people it kind of offers a little bit of redundancy.
Okay.
With you being young, we have to treatment plan you different than we do a 70 or 75.
Okay.
That would be my only recommendation. But our prosthodontists, are also phenomenal. So, all my female patients, when you see your teeth later on, you're just gonna be so happy.
I can't wait.
So, yeah.
I'm excited. Awesome.
What other questions do you have?
I know the last dentist that I saw said I would only need 4. I don't know if that's just.
So I like 4 on the bottom.
Okay.
Your lower jawbone is more dense. Like I said, so when I evaluate your sinuses, so what we'll have right here is you'll have a 1-tooth cantilever on each side, meaning because of your sinuses, we can't place an implant in your sinus, right? We could, but we're not getting support from it,
Okay.
right? And you've probably seen these videos online where I was given an analogy. It's like, if you didn't know how thick this drywall was, you know, if it's only 1/2 inch thick, me burying a 2-inch screw in it's no different than a 3-inch screw versus a 1/2 inch screw.
Okay.
It's not getting any support in the air.
Got it.
Similarly, if I was trying to get my implant for the back, because let's say your molar is going to be right here. If your last implant's here, you're going to have what we call is a cantilever, right? So, you know, All-on-4 protocol, it was amended in 98, right? So it's a 26-year-old protocol. It's great. We see awesome results from it.
Okay.
We do a lot of 4 implants on a lot of patients. We also do a lot of 6 implants on other patients, right? So when a patient comes in and they ask me, what's the long-term longevity on what my implants, like on my All-on-4, if I was, you know, so that I don't ever have any problems? Because I, you know, as I see, like, you know, see many patients like yourself, we don't want to do something and run into problems, right? So Dr. Koo and I actually had a discussion about this even a week ago. He said that he would do 6 to 8 in his mouth.
Wow.
You don't want it. Like, but then it's like, the reason why we say that is that because it's always the unknown.
Okay.
Right? So if you have more implants, then you can distribute that force over more implants.
Yes.
Which means less stress per implant.
Okay.
Right? Not saying, but like, again, we can't predict whether we were to ever have any issues. Now, we could do 4 implants on you and maybe be okay, maybe not be okay.
Right. You'd rather be just safe than sorry, basically.
It is that aspect.
Yeah.
Right?
Okay.
So I'll give you people...
Because you can't go back and add more.
Exactly.
Yeah. Okay.
Because if there is an issue, then we got to do another implant and then we have to make you a whole nother set of teeth.
Got it. Okay.
That is a one risk. So here's the beautiful thing about our practice. So we will actually add those 2 implants at cost.
Okay.
We don't even charge for our labor.
Okay.
So, you know, I own Texas Dental Surgery. I want you to have a good, long-lasting result.
Thank you.
If you have problems, I have problems.
Right.
If you have more appointments and you need another set of teeth and you need more implants and more surgery, that's more time and money that I'm not being compensated for because I actually warranty my product, right?
Got it.
So that's why I tell patients that we make that financially very feasible for you so that we can encourage patients to get that added redundancy.
Okay.
Now, when it comes down to it, you don't have to get those extra 2 implants, right? Some people, their sinuses, you have to get those 2 extra implants.
Okay.
But with you, you don't have to. Okay. So have that discussion with Rodney.
Okay.
We never try to pressure patients. We want you to feel comfortable with that decision.
Sure. Yep. Well, I appreciate it so much.
Yeah, no problem. Any other questions?
I think that's it. I'm ready to move forward.
Okay, cool. Talk to Rodney. He'll take care of you.
Okay. Thank you so much. It's nice to meet you.
Yeah, no problem. Very nice meeting you. If you don't mind me asking, how did you find us originally?
The internet.
Okay. Just Google
stuff.
Okay.
Yep.
Awesome.
Came across your YouTube videos and my husband was like, that's who you're going to. I was like, okay. And my husband's in the, sales field and he's a GM for a dealership and he runs into customers all day long. He deals with them all day long and he's very much about customer service, making sure you take care of them right because he's the same way. He doesn't want to have problems. He wants to make sure it's done right.
Yes.
And he doesn't have to keep having issues with people. So
yes.
Yeah.
Prevention of issues.
He knows, like when he sees someone, he knows when it's like that connection of they know what they're talking about. He knows what he's doing. That's where you need to go. If you have to drive an hour, 2 hours, go see him.
Yeah.
So
I'm the same way, actually.
Yeah. That's why I'm here.
Yeah. Okay.
He wanted to be here, but he couldn't be. So I'll
get
get information.
Well, I'm excited to meet him.
Sure, you'll meet him. Yeah.
All right. Well, it's very nice meeting you.
Thank you, Dr. Choi.
Have a good one. Take care.
You too.